Awesome. So let's go ahead and get started. Thanks everyone for joining us. My name is Kat Stafford. I am a reporter with the Associated Press. I am the National Race and Ethnicity writer at the AP, and I'm also a Detroit Young Professionals board member. So thank you so much for joining us tonight. We really wanted to have a candid conversation about mental health. During the course of my reporting, I've been doing a lot of reporting on COVID-19 and the impact the pandemic has had on people across the country. We really wanted to have a conversation that allowed our members to gain some tips to learn how to navigate this challenging time, learn some ways to cope, and find ways to hopefully help even your friends and family members. So without further ado, please, Doctor, go ahead and introduce yourselves to everyone.
Thanks, Kat. So my name is Dr. Anton Babushkin. I'm the CEO of Wellness Psychotherapy. We're an outpatient clinic, and we specialize in helping people live high-quality lives. In other words, what brings a person into treatment is often something that's troubling them, but hopefully the long-term outcome is more well-being, better relationships, more satisfaction out of their life. That's the long-term goal. So that's the kind of work that I do, and I run a clinic with 10 therapists doing that every day.
That's amazing. So let's go ahead and dive into these questions. We're fortunate, and thank you so much for everyone who submitted some questions. These are some really interesting points, and let's get right in there. So, many people who work from home, Doctor, they say that, they're working longer hours, and, because we're in quarantine, a lot of people are spending more time on social media, which means that we're more likely to be overcome with stories of personal trauma and loss. So what are some coping mechanisms that you can suggest for people, and how can people truly unplug?
I mean, it's a good question because on the one hand, maybe just as like an initial comment, I think everything mental health related, it can be complicated, right? So I think, I know, Kat, you and I talked about this before, that part of the goal of this conversation is not to make anything simplistic, not to say that there may not be like an easy answer, but that doesn't mean there aren't potential answers or potential solutions. So my goal, I think, in this conversation is to say that for many mental health difficulties, people can find resources and the help that they need. It's just not, it's not always amenable to like a slogan. It's easy to say like, oh, go out there and unplug, right? But it's the details of what that takes that's so hard, right? So I think my thought about this question is, we want to stay informed because it's helpful to know what's going on in the world, what's going on with COVID-19, what's happening in our neighborhood or the economy, right? There's a lot of questions, obviously, but I think it's kind of like setting limits because so much of it can be overload. We only need so much information. I think in the news cycle we live in today, in my opinion, sometimes these stories are written to have something to talk about and fill the news, which is not bad from it's content, but as a reader of the news, you don't have to be up to date on every single detail, right? You have to know, like, okay, what's going on in my area or what's going on with my job or my family. I think the trick for me is to try to think more locally in this kind of situation. Try to think, okay, how can I take care of my day-to-day and not be so consumed with what's going on with things I absolutely can't control. I don't know what's going to happen in China, for example, right? I mean, it's important. I do think it matters, but I think in this kind of crisis situation, doing less is more. Trying to say, well, how can I get through the day and do the things that I need to do? And setting those kind of routines and trying to actually stick to them. You know what I mean? Like, if I'm going to read the news, I'll read the news only for a few minutes to make sure I'm not overdoing it. Because ultimately, what seems like a mindless activity can actually, sometimes we do things to avoid something else. I could be on social media to avoid my stress at work or something that's going on in my family. So it's good to be mindful of that. Does that make sense?
Yeah, for sure. And so diving a little bit deeper into these
Yeah.
points, what are some tips that you recommend people, can do to maintain positive mental health under such extreme stress right now?
Well, I think positive mental health usually translates into paying attention to one's own needs, right? In order to, usually it's like with physical health. In order to be physically healthy, it's good to know, like, what are my needs? Exercise, healthy food, fresh air, right? It's kind of, you need to know what the basics are. So the same is true in mental health. Mental health is usually, excuse me, how can I take care of myself? How can I have people in my life that are supportive? So it's sort of like knowing what things matter to me and then trying to actually implement them. And I think that's a really hard thing for people to do. We're often so caught up in either things that we're worried about or things that we're doing day to day that we don't stop and sort of check in. Like as a therapist, I often find myself asking people, okay, well, what were you actually thinking in that moment? What was the experience actually like for you? Because it's easy to notice a sensation like, oh, my heart was racing, or, I was anxious, but it takes a little bit extra effort to think about what am I most stressed out about? Right now I think the situation is difficult because there's a lot of real things to be stressed out about. What's going to happen? Am I going to get sick? Am I going to lose my job? Is somebody I care about going to get sick? Right? There's a lot of like real life scary things. But at the same time, again, going back to the less is more idea, I think the best thing you could really do is to try to think about what do I need to do at a minimum every day, just to try to be okay. Whether that is get outside for a few minutes, talk to somebody I care about, to have like a supportive conversation. You know what I mean? It's kind of doing small things that I think all add up. It doesn't have to be some huge. It's really hard to kind of change. Usually, this pandemic is hard because you come into the pandemic with coping skills that may or may not be working for you, and then there's a stressful situation in which it's hard to manage. So I think it's good to start small and try to have some kind of successes every day. I did this positive thing. I took care of this or that, and let that success kind of build on itself. I think that's one thing that many people find helpful.
Yeah, and so what are some practical actions that folks can take to prevent mental distress?
Maybe we could think about it in terms of like, first of all, you have to know like what's the distress, right? Like if I'm stressed out about, like, I live by myself, so a lot of my personal distress comes from, well, I feel kind of disconnected from people, or I'm not really around my usual social circle of people that I see. So if I can identify that and identify like what's stressing me out, I'm much more able to come up with at least some kind of manageable strategy. It might not be the same as it was 3 months ago prior to this whole crazy situation, but it's at least I've identified the right stressor. So I think that question, the best way to answer it, I think, is to think about what specific distress is it. You know what I mean? Like, do you have something in mind? I know you're reading from some of the submitted questions, but maybe if we treat it sort of as a conversational topic, what might be something that a person's stressed out about that you and I can kind of think through together? What might be a distressing thing?
That's a great point. So, reporting on this, a lot of people, specifically thinking about Detroit, the city of Detroit, so many people have been touched by this crisis, whether it's a loved
Yeah.
one who has passed away. So you have people that are trying to go through the motions of grief. Grieving and isolation has been a major thing that I've been talking to a lot of people about. So, do you have any tips for that? We're not able to have funerals in a typical way that we normally do. So you have a lot of people who may live by themselves and they're grieving the loss of a parent. So how do you navigate it?
I think that's an excellent point because there's so many losses happening at the moment, and the worst of them, of course, being people dying, right, or people that we care about. I think it's a great point because one of the things that funerals do is they help to organize a very painful situation. It's like having some people around you or some kind of methodology to deal with a very big event that's hard to manage. So in the absence of funerals, I think we have to be creative and sort of, I think that what people are doing is they're finding ways to grieve together through technology, whether that's a support group or an online meeting or a Zoom funeral, so to speak. You know what I mean? Those things are not going to replace the actual experience of grieving with your family or with your loved ones in the same room, or in the same place. You can't like replace that. But I think it's like saying, okay, if it's like here's a silly example. I personally try to not eat a lot of sugar because I think it's unhealthy, but I still want sugary things. So I might eat something small like a grape because it still does something. It sort of reminds me of, okay, that's a sweet tasting thing, but it's kind of healthier than eating cake or whatever, right?
Right.
So in this situation, having a Zoom funeral is nowhere near having a real funeral, but it's like a taste of that support, or it's like at least a connection point where you have other people connecting with you. And sometimes, okay, if somebody's isolated, and let's say they don't have Zoom or they don't have internet access, okay, it doesn't have to be that. It could be walking outside and maybe trying to say hello to your neighbors or somebody you meet. You know what I mean? It's trying to find a creative way to recreate what we don't currently have to sort of manage. We're not going to be able to have some of these experiences for the time being, but it's kind of like managing and doing enough to get by. You know, I think that's one of the harder things I think in the world of mental health is what's good enough. You know, like you can't have like a perfect way of dealing with some of these situations. It's trying to find like something that's okay or manageable. Does that make sense?
Yeah, it also makes me think about, the fact that this is a group geared toward young professionals, and a
Yeah.
lot right now, specifically small businesses, are struggling to find a way through this. So, do you have any advice for our entrepreneurs who may be watching, and just, how do you cope as a business owner or someone who's just trying to find their way in their profession through all of this?
For sure. I mean, I think entrepreneurship is challenging to begin with, right? It's kind of like constant challenge of a roller coaster. I mean, I run my own business, and 1 month or one day you think like, wow, I really got this figured out, and things are working fine, and then something changes, and 2 days later you sort of lost again. So I think to begin with, entrepreneurship is challenging, but I think that it, what I think helps in these situations is again having some kind of point of contact with another person, like having a mentor or somebody you could reach out to, because some situations they're just more bearable when we have people in our lives. They might not fix the actual problem. Like many businesses right now have to close because of the various shutdown orders, and so they can't really find customers. Or even if they can find customers, it's much smaller numbers than they had, 3 months ago. So the goal for them, I think, is not necessarily at the moment to be back at full swing because they're not able to, but more like, what can I do in the meantime that feels meaningful, that hopefully keeps my business afloat, which might be like, whether government support, financial support, or some kind of customer base that at least gets me some money in the door. Again, it's finding something that's manageable and that gets me through the day, knowing that over time, if I keep doing that, eventually we're going to find some solutions to the virus and be in a better place as a society. But for now, we kind of have to stick together and do what's possible on a day-to-day basis. Even like even our meeting today. In sort of better times, we probably would be doing this in person, and you kind of have a connection of who's in the room and what questions that people have, and it's more of a dialogue of many voices, right? And it's hard to recreate that. I mean, I think this is a really nice middle ground. We're still connecting with lots of people who are on the call, but we try to sort of manage to say we'll do the best we can to offer hopefully something helpful and keep that momentum going, and hopefully times will improve, and then we could do more over time.
That's great advice. And so going back to some of the submitted questions, one thing a lot of people wanted to know about is it's hard to find motivation to wake up early, to exercise, to eat healthy, to work hard when, no one really knows when things are going to go back to normal, if they ever
Yeah.
will. So how do you stay motivated? Do you have any mental tips along those lines?
Personally, what I think helps, what at least helps me is I try to think of, if in the past I would think of like week-long goals or month, goals that are like a month out or 6 months out, 6 months out. I think these days, most of my own orientation is almost just day to day. And I don't mean that in a kind of cynical way of what's the point. I just mean like, okay, like yesterday, my AC wasn't working. So one of my goals for the day, aside from like working, was just like, okay, can I get the AC fixed? So I'm not, I mean, I know AC is like a luxury, so I don't mean that's like some huge issue, in the world at large, but in my own day, that was like something I was dealing with. I tried to call, and the AC was just installed a few months ago, and it was the first time I tried to turn it on. It wasn't working. I called the company. They didn't respond. I was really annoyed. Finally, at like literally 11:30 p.m., the technician shows up at my house. He's sweating. He's been out like all day doing these calls because everybody has the same issue. And we kind of had a nice chat, kind of nice. We kind of, bonded a little bit over the situation. He fixed the AC, and I felt like such a sense of relief. I felt like, wow, mission accomplished, so to speak. And I know that's like maybe kind of silly, and I don't mean that's going to take away the death and destruction that is going on in our society. Obviously that doesn't fix, some of the things that we're talking about. But I think on a day-to-day basis, I think that's more manageable because it's something that I actually have a say in. I unfortunately, personally, don't feel like I have much say over the national policy or even the regional policy about how we as a country are responding to this virus, right? I mean, okay, I could call my senators or I could, get involved in political stuff, which I think matters. But at the end of the day, I feel like I don't have as much say over that. But what I do have some say over is how I live my life or what I do in my day. And so to me, things like getting up early or working out or eating healthy, I think of it as a source of empowerment because it's something that I can do that's like mostly up to me. It's something that has direct benefit, and it's much more controllable than fixing the economy, so to speak. You know what I mean? So I try to think of those things as kind of like it's like if you make a deposit in your bank account of $10 a week or whatever into a savings account. I think of all those actions. If I woke up 10 minutes earlier today because I'm trying to get into waking up earlier, I think that's like a deposit of like a positive momentum that I want to stick with. And those small things, maybe they feel minuscule, but I personally think that they contribute to like a sense of self-confidence and like a sense of empowerment that could over time help you have a more sense of agency over your life. You know what I mean?
Yeah. I mean, I found that myself, just going through the motions. I felt like the days were blended together. So I tried to structure my day a little bit. I'm going to commit to 9 to 10. I'm going to work on this part of my story. So it's kind of helped me. So that's great advice.
For sure. Or like just to answer your point, I mean, because part of the question was, it feels like this is like what you're saying. It's like a time that blends together. I definitely think breaking up the week into like I have a friend. He's actually on the call here with us, John. Shout out. But I think that we sometimes will meet up and like go for a walk outside or whatever. And having that as like something I do almost makes the week more like it's not just every day is blending in together. It's like on certain days I do this. You know what I mean? Just like you're saying, it gives it a structure, a routine.
Hey, one thing that I was thinking about, this isn't on our list of questions here, but
yeah.
I'm thinking about our healthcare professionals
Sure.
that work in these high stress jobs who are really day to day dealing with these situations up close and personal. Do you have any advice for people who might be in those fields of work that are just, they're overcome with this every day?
I think that it's a really nice question because I think that it's a very, very hard environment. I mean, I think a lot of the frontline people, like whether they're working in a grocery store or driving a bus, you know what I mean? When you're in those settings, when you're literally vulnerable, I feel like when you're working from home, so to speak, it is tough and it is stressful in other ways, but it's not as immediately threatening, maybe, or not as like high risk of being infected with something, so to speak. And so I think that for people who are in the healthcare world, it's very, very stressful. But I think one of the, actually, my friend and I who's in medicine, we did a video on this a little while ago about how one of the things that I think happens in medicine is that there's this idea that asking for help is, you should be kind of superhuman, or you're the caretaker of others, you're the professional. And so asking for help or acknowledging I could use support can be hard. And sometimes those medical settings, because it's such a fast pace and they're under so much pressure right now, there may be not a lot of room from the administration to say like, okay, take time for yourself. You know what I mean? Like, I don't know how that's being handled in the culture of the organization. So, but the good news is many, many therapists recognize that those frontline workers, not only, I know we're talking about medicine, but other frontline workers are under a ton of stress, and many therapists are making their services available, sometimes even initially for like a free session. Like for example, I have my clinic has a contract with a medical group where their first session is free, right? Or I know that we're going to put on the Detroit Young Professional website some resources after this talk, after our conversation. But there are literally groups of therapists organizing themselves to say, we know that this is a very stressful time. We have some, tips or things that we could do. Please call us and reach out. And sometimes it's free, sometimes it's reduced fee, sometimes it means, insurance payment or whatever. But help is definitely available. I think it's the taking the time and saying, I really need a break, or I really need to cut out 45 minutes out of my week for myself. I think that's a really hard thing to do because the expectation is go into work, take care of people, take care of your family, which all makes sense, right? But it's just hard to do. It's become such a grind that there's not enough sort of self-care. And without that kind of recharge, I think it's much harder for anybody, me or you, to do our jobs when we don't have enough, just a chance to kind of reconnect with ourselves. You know what I mean?
Yeah. That's actually a great point. Self-care. Can you explain how important that is, that in the midst of all of this, that we all take a moment to kind of step back and just practice a bit of self-care in whatever way that may work for an individual?
I think one of the interesting things about the topic of self-care is we as a society, I think, say it more now. Like at least like on my LinkedIn page or when I'm online, maybe because of the groups I follow, but there's a lot of comments like, oh, I did this for self-care, or people say like, oh, I did some retail therapy today, right? There's kind of like a lot of different things people say, and I think there is some value to that. But I think the difficult thing about self-care is um, self-care is learned in one's upbringing. In other words, how we take care of our own needs usually has to do with how we were raised, meaning like if I had caregivers who were there for me enough, right? Or kind of instill the idea that taking care of myself is important, I'm probably going to have an easier time making time for myself because I was sort of raised that way, right? But if I was raised in a way where maybe I felt like overlooked or neglected or whatever, I might intellectually know that self-care is important, but have a harder time applying it because I don't have sort of the know-how. Nobody kind of walked me through it. And that doesn't mean the person is stuck or kind of like is helpless, or whatever, or just doomed for not taking care of themselves. But my main point is it's a learned skill. And anybody could learn how to take better care of themselves, but it means starting with, let me do a self-check-in. Let me pay attention to, let me spend 5 minutes today saying, okay, how do I actually feel? What's actually going on in my life? Kind of like take stock of one's life, right?
Yeah.
And sometimes it can help to do that with a friend because maybe I'm not good at noticing what's going on with me. Sometimes people who are close to us are more able to say, "Hey, are you okay?" Like I was talking to my aunt today on the phone, and I had kind of a long day, a lot of sessions, and she said like, "Hey, your voice sounds like you're kind of, are you okay?" And I said, "Yeah, actually, it's been kind of a long day." So it was a really nice observation because one, it's a shared moment. Two, it's kind of like a moment of support. And three, maybe like without her saying that, maybe I wasn't as tuned into, hey, how am I doing and how can I take care of myself, right? So we had a little chat, and I went outside. I had like a half-hour break. I'm reading this book. So it was kind of like, it gave me a chance to sort of reflect about the day. You know what I mean? And I don't mean that that's always an option or that's some kind of easy thing to do, but self-care starts with good self-observation and hopefully having some people in our life who can, if we're kind of off track, you know what I mean? If we're sort of not taking good care of ourselves, hopefully having somebody who could say, hey, are you all right? Like something seems different, you seem kind of off base. It's like a chance to check in. I think that's such an important starting point. I don't know if that helps to kind of answer your question.
Great point. And it kind of leads us to the next point. You kind of already touched on this. A lot of people really wanted to know how can they obtain free access to mental health care. There might be a lot of people who have never gone through the process before and don't quite understand how it works. So can you kind of walk?
Sure. It's a good question in the sense that, first of all, you should know that there are many mental health resources available. I mean, they're not always perfect and they're not always within like the easiest reach, but there are people who can help in many situations. So, for example, again, I know we're going to put on the Detroit Young Professional page some resources, after this meeting, or maybe Michael's already put them on there. But basically, there are some clinics that have financial support that offer either free or reduced fee therapy. So I know of a nice clinic like that. They have two locations, and actually right now everybody's working remotely. So we're going to put that on the website or on the Facebook page because people should know that um, if they don't have insurance, that doesn't mean they can't get help. Now, sometimes not having insurance means there's like longer waiting lists or they have to kind of go through a lot of red tape, if you will, but it's worth the effort because there are people who want to and are willing to help them. The hardest thing about therapy, in my opinion, is it takes a lot of courage. It's like saying, I'm going to reach out to somebody I don't know, who I've never met before, and I sort of only know their name or like their credentials, and I'm going to trust them with something that's very personal that maybe I've even tried to get help with before, or I've asked somebody about, or I haven't been able to solve on my own. How am I going to do? You know what I mean? That's a real stuff of courage. You know, like I can tell you like a personal example. I was when I was going to college, I was dating this girl, and I was kind of like unsure of what I wanted to do in my life or my career, sort of feeling lost. And I was telling her this one day, and she said, you know, have you ever thought about talking to a therapist? And I said, like, what? Therapy? I don't know, like, I think it's that bad. Like, I'm not really, you know, like I thought I was kind of iffy about it. And then a few days went by, and I was still feeling sort of miserable. And so I thought, you know, why don't I just give this place a call and just see what happens? You know what I mean? And luckily, it was a good connection, and it really helped me. And it kind of now, you know, it's inspired me to do the career that I'm doing. But I think that first step of acknowledging something is bothering me, and then somebody could potentially help me. It's really hard to trust, I think, to take that leap of faith. But my suggestion is that it's really worth it because even if you take that chance and the first therapist you meet is not that helpful, okay, that doesn't mean that you're broken or that you can't get the help you need or that it's not available. You know, there are not only good therapists in our community, but there are resources so that to try to make therapy more affordable, because I know affordability can and is often a barrier. You know what I mean? So I know that's not, I know this is not like a Google Maps response where I'm saying go to this exact place, because it somewhat depends on where you're located, what your needs are. I think actually right now is sort of an easier time to get therapy because all therapists are working remotely, meaning let's say you're in Detroit or you're in Ypsilanti or you're in the UP, you know, but you have either a internet connection or you can use a phone. Any therapist in Michigan could help you virtually because most therapists are working remotely. It's almost as good as being in person. Not exactly, you know, I'd still prefer to see the person, you know, in my office, but it's 90% as good, I think, especially in this situation. And so there's many therapists who are open and therapists are business owners too. You know, they're usually running their own practice or something like that. And so they're trying to get by and kind of survive and sort of make do. So they're willing to be flexible and work with you. So, and some insurance companies right now are doing a good job of covering like co-payments or out-of-pocket payments. So there's less of a burden financially on the person. So in a sense, there's no better time to try therapy and to try to find somebody you could work with. And if that first try doesn't work, it doesn't mean there's something wrong with you or you can't be helped. It may mean you need more of a specialized approach. And in addition to the stuff that we're going to put on the DYP page, people can call my office. I'm happy to talk to them if they have specific questions to try to make a referral or recommendation. I'd be happy to do
So you brought up kind of the telehealth option, and we did get some questions around that. So could you kind of talk a little bit more about your thoughts on, you know, physically attending sessions versus having these online therapy sessions? Is there a better connection that you feel with your clients and patients versus, you know, online? Are people more likely to open up to you? What are your thoughts?
You know, it's kind of a funny story, I think, because 3 months ago, if somebody would have said to me, like, do you like doing telehealth or do you like, you know, working on the computer? I would have adamantly said, absolutely not. I don't want to do it. I don't want to put it on my website. I don't want to, you know, I don't want the world to all of a sudden go telehealth. That would be terrible. But now that I'm doing it every day, I actually really like it. I mean, I still think having human contact makes a difference. There's certain things that you could tell, you know, when you're around a person, you can kind of read their body language and sort of get a sense of their emotional state. You have more access, you have more information. It's kind of like doing like a physical exam. If you go to a medical doctor, you can see a lot, you know, right now medical doctors are doing a lot of online appointments. it's not bad for an established patient or if you have something that's like somewhat recognizable symptoms. But doing an assessment in person usually helps. But I think I wouldn't want it to deter anybody from trying though, because it's still a very good option. I mean, I have found that working on the computer or by phone is almost as effective as in person. And for some people, they actually find it easier because they say, you know, when I'm not in front of you or I'm talking to you on the phone, I feel like I can kind of tell you more things that I would be shy about saying because you're not there. Or, you know, they might say, I kind of have control. I can kind of hang up on you right now. If this session gets uncomfortable, I could just turn off my phone and there, you know, there you go, which they couldn't really do in the same way in the session, right? So I think people actually find some degree. It's like why are online forums a lot of times filled with like really nasty comments or sometimes really funny comments because there's a sense of anonymity or freedom in like speaking, you know, online. So in that sense, I think it could be liberating for people to say, you know, I was afraid to do this or kind of intimidated, but I'm just talking on the phone or it's just a Zoom meeting, you know, I'll just try it. So I do think that can facilitate. I think that's one of the best things about telehealth is it's sort of like a good on-ramp. You know, it's an easy, maybe easier to get started that way than it is in person because it doesn't require going to some building or finding some place or meeting somebody, which sometimes people have a hard time with. So I think it's a great option actually. And like personally, I think even after the pandemic is over, hopefully someday, we're gonna continue doing telehealth because I think it's such a good additional option. Maybe not the, I wouldn't want it to be the only option, but I think having it as an option is great. If you're traveling or you can't make it that day or you have a tight schedule, telehealth is a really great option.
And so speaking of telehealth, this is something that I've kind of always wondered. How do you
Yeah.
go about finding a therapist? You know, I'm sure a lot of people specifically, they might want to talk to you, you know, they might want to speak to a man, but
Right.
might want to speak to a woman or a person of color. So how do you go about finding someone?
Well, I think there are basically, let's say, three good options. One good option that a lot of people use is this website called Psychology Today. Psychology Today is like a directory. I had a friend who's a clinician who described it as the Facebook of therapists. Basically, every therapist puts their profile on there, and we're all trying to kind of say, hey, this is who I am. We have a picture. Now, Psychology Today allows you to upload like a little video even, you know, kind of like an intro to who you are. So it's almost like a dating app or whatever. But okay, so you go on to Psychology Today, and there's a bunch of profiles. You look by your zip code or by your insurance or by certain preferences. You kind of select your search, and then you find, you know, a list of therapists. Now, it's kind of hard just from the website itself because people's profiles can tend to sound similar. I care about people. I've worked with people. I've helped people. You know, I mean, we all say that because that's the line of work that we're in. So if you could narrow down that list to, let's say, like 3 therapists that you think you could potentially kind of match with, I would just call each person and say, and most therapists are okay with this, and say, can we talk for a few minutes? I just want to kind of get a sense of what's our connection like. You know, how's the conversation going to go? Can I ask you a few questions? Most therapists will do that for free because they're also trying to do an assessment of, okay, are we a good match? Do I feel like I can help you? What's your situation? Am I the best therapist for you? You know what I mean? So both people are kind of doing like a sort of assessment in a very friendly way. And so that's one way. So Psychology Today is a good approach. Another good approach is you could ask either, you know, friends or family or like your primary care doctor if you have one. They'll often have like a go-to referral. You know, they'll say like, oh, I've worked with such and such therapists that we've had good results. So there are often informal networks. Another way that I think that's really helpful is if you know like a trusted brand. Like a lot of things that I do with my own clinic now is I try to do a lot of public speaking because I want people to feel like, hey, you can call us and we can answer your questions. Even if you don't end up working with somebody in my office, it's totally fine. We offer it as like a community service. If you call our office and you have a question about therapy or who might be a good therapist for you, we try to help with that because we want people to be informed decision makers. We want them to make a decision that actually works for them and that they know what they're kind of getting themselves into and they feel happy with that. You know what I mean? So my clinic does that. Other clinics do that too. So that's another way of doing it. It's kind of like going to like a trusted source and saying, hey, I'm not sure if this is for me, or I don't know if this is even something that needs therapy, but can I ask you a few questions, right? And one other thing about this topic that I think is often overlooked. People, I think, often say they wait to go to therapy until things are really bad. And which is fine to do, it's your own choice. But I think a better way to treat therapy is kind of like, just like a check-in, like you go to get your oil change, every 3 months or whatever, or you hopefully go get a medical appointment once a year, whatever it is, right? Things that may not say that something's wrong, but it's like just like a touching base. I think therapy could be a good way of doing that because it helps you get to know more about yourself and the pros and cons of whatever's going on in your life. Does that make sense?
Yeah, yeah. And so another piece of the pandemic is, you kind of alluded to this when you said, when will it be over? If it, and I said, if it will be over, And so a lot of people might be feeling anxious about when will this end, or they might be feeling depressed that they can't see their best friend or their mom or their. So how can people deal with anxiety and depression amid this pandemic?
Well, I think again, there's sort of a two-part answer. On the one hand, depression and anxiety is best dealt with by getting help, and I say that in the sense of not that you can't deal with it on your own, but hopefully you don't feel like you have to, because it can be a hard thing to deal with. It's hard to man if somebody's feeling depressed or they're really struggling. It's like saying, how can I treat my diabetes by myself, so to speak? You know what I mean? Like, you don't have to. Hopefully you have some access to some healthcare where you can get at least some assistance with that, right? So that's one part of it. But the second part is that to be realistic. Trying, like, yeah, when I read the news about like, oh, there's a vaccine clinical trial, I think, oh my gosh, this is great. I'm going to see my friends so soon. Like, I like salsa dancing, so I think, okay, salsa dancing is going to be back, 2 months from now, and everything's going to go back to normal. That's probably not going to happen, or at least not in that way. I mean, it's nice to have those kind of moments of, excitement or whatnot, but I honestly think it means trying to do very small, it's like that slogan of, think globally, act locally. In other words, yeah, we want to be mindful of what's going on and be hopeful about the future, but ultimately, I would try to do what's in your control. Whether that means, okay, going to the park if you can get outdoors, or if if you can't see your family, can you talk to them on the phone? It's obviously not the same as the things that we used to do before this whole thing happened. But I think you're much better off doing something realistic today than kind of waiting for things to get back to normal, because we don't know when that's going to happen, and that could be very disappointing when it doesn't come about soon enough. I'm sure at some point, things are already, like in Michigan, even though the stay-at-home order is still in effect, you could see on the street people are driving more. You could see, like, larger groups of people. Okay, I'm not going to say where, because I guess maybe that's like a reportable offense or whatever. But the point being that I think things are already sort of coming back to a little bit of a more normal state than they were. So that's very promising and encouraging. But I still think that doing the day-to-day and taking care of yourself is much more important, because you have a say in that. You know what I mean? I'm a strong believer in, I'd much rather kind of focus on what am I in charge of in my life, and what can I do something about? I think that sense of empowerment really gives like both a confidence and kind of a satisfaction. Okay, maybe I didn't solve XYZ problem, but I did my part, or I did some small but meaningful thing that actually helped. You know what I mean?
Yeah. And what about friendships, in the sense that I think, at least for myself, at some point, I've had a friend who I thought may have been dealing with something, but I didn't quite know how to approach them and suggest, hey, maybe you might need to seek some help, or so. So what advice do you have to help people encourage their friends to seek mental health help?
I like the question, and I think it's a sensitive topic, because not everybody is open to that suggestion, right? Like, when I was first started in my career as a therapist, I would often kind of give sort of unsolicited advice. If somebody, like a friend, mentioned something to me, I I'd sort of go into like therapist mode and say, like, oh, well, how did that happen? And without even like fully realizing, I was just kind of like, because I was so in the middle of like doing my training or whatever that I would sort of go into this like automatic response. And sometimes my friends would say like, don't therapize me, or like I'm not asking you to be a therapist right now. And so it made me like really step back and say that often what people need, is our support and our encouragement. And yeah, you could voice something like, I'm a little worried about you, or is there anything I can do? You know what I mean? I think it is good to say, it's like when people lose somebody to a death and they say like, the hardest thing is that people are afraid to talk to me. They don't know what to say. And I wish they would just say something like, hey, how are you? Or how are you dealing with things today? You know what I mean? Like some kind of comment. So I think almost any thoughtful comment like, I'm a little bit concerned, or are you doing okay, is worthwhile because it gets the ball rolling. Then you could kind of read the conversation and see how responsive they are. And if they say like, oh yeah, I am kind of having a hard time, you could say, okay, there are resources available. I'd be happy to share them with you if you want. But I would do it very lightly, because therapy is most effective when you, the person, really want to do. It takes a very active effort. You have to be willing to kind of put in the effort. So if your friend or family member is either not recognizing the issue or is not willing to do something about it, you could give them the best referral in the world, so to speak, but it's not going to go anywhere because they're not contributing, their own part. And so, because therapy is really like a collaboration between two people, the patient who brings their life experience and their knowledge of themselves, and the therapist who brings professional experience and knowledge that will help kind of put things together, right? So when you put those two forces together, you usually get a very good outcome. So when it's a family member or a friend, of course, I think, or a spouse or somebody, of course, it makes sense to say, I could tell you're struggling, or I'm a little bit worried about you. But I wouldn't push them, because they have to take those steps on their own. The only thing you could do is to say, there's help available if you're looking for it. That's how I see it.
And what about a situation where, say you yourself, you might not be that much of an emotional person. You don't quite know how to offer support to someone who might be not necessarily dealing with a mental health situation, but they just need support. Like, I had a friend who lost both of her parents to COVID.
Oh, wow.
And a lot of us did not know what to say to her, or what to say beyond, we're sorry for your loss. So
For sure.
how do you navigate something like that?
I mean, it's a sensitive issue, of course, right? But I think asking questions can be helpful, because, yeah, we don't know. Like, for example, you could say, how are things going with you? Like, to try to inquire about what is her experience, because often what's helpful is just to be heard. The feeling of somebody's listening to me, or somebody's there or willing to kind of be with me during a difficult time, is by itself a very helpful kind of therapeutic experience. So I know this question was in our list of like submitted questions of, if I'm not a very emotional person, how do I respond to somebody? I think you could respond by saying, how are you dealing with the stress, or what's most difficult for you, or what do you find to be helpful, or how are you managing? Like, I think right, somebody wrote in the text here,
Right.
great question. That's like I think that's a great point, because you're basically saying, I'm checking in with you. How are you feeling? What's going on with you? Can I be there for you in a certain way? Not that they don't have to, they might not even know what the answer is. They might say, I don't know, I'm really stressed out. And like your friend, I mean, losing both parents, I can't imagine how awful and sort of life altering that would be. But being there and being willing to ask, like this really nice question, how are you managing? I think that says, I care about you. I'm here for you. And there may be no great solution to this awful loss, but I can try to be there for you to help. You're not in this by yourself, so to speak. You know what I mean? I think that's a very powerful message that does make a difference.
Job loss has really impacted so many people across the state, across the country. And one of the questions that was submitted to us was, how can you be supportive in a situation where maybe your spouse or your partner lost their job? How do you deal with that?
Yeah, I remember that question. I think that that question really stood out to me, because it sort of requires kind of like a stepping back in the sense of, first of all, you want to be support. Like, I think the question was something like, my spouse is worried about losing their job, and I'm also worried about our financial situation. And so how can I be supportive to them, so to speak, right? So I think my answer is something like this. First of all, you don't have to not be worried about your life to support somebody, because the goal isn't to not be worried or be perfectly together, be kind of like have it all together. It's more to say, I know you're worried about this thing. I'm worried about it too, but I think we could make it through it by helping each other out. We're going to be here to kind of, regardless of what happens, I'm here for you and you're here for me, and we're going to figure out some kind of solution. You know what I mean? Because I think often the idea people have is being strong means having, no problems or no difficulties, no stressors. Like, sometimes people say to me, I often try to say when I do a presentation that I've seen my own therapist. Why? Because it's to try to say that therapists are people too. What makes somebody strong is not the absence of problems or the lack of stressors. It's having some degree of being able to deal with them, or at least for the most part. Maybe not every day or not, in a perfect way, but like kind of some coping skills, as we call them, right? So I think for the person who's talking about their spouse, I would just acknowledge and say, yeah, I'm worried too, but I'm here for you, and I think we'll be able to figure it out. I'm going to support you. I know you're there for me, and I don't think we'll make it work. You know what I mean? That's acknowledging the reality of the situation, and also saying that I have some hopefulness that I think we together we can make this work. You know what I mean? I think that makes a difference too.
Yeah, and so I'm going to throw a question at you that I kind of wanted some thoughts on. So,
I'm not ready for it. I don't know. I'm not ready.
what well, I know this organization, DYP, we are geared toward young professionals, but young
Yeah.
professionals have families and children. So how do you maintain your mental health, working from home with children? And what about the folks who also might be caretakers and are taking care of elderly family members while also trying to navigate all this?
Yeah, that's a question that's like the $1 million question, so to speak. But I think, like, I have a friend who lives in New Jersey who's a therapist who gave me a good example. So he and his wife are both therapists. They're both working from home, seeing people. And part of the way they've made it work is through a lot of communication and structure of who's going to do what when. You know what I mean? There's so many things that need to be done: childcare, work, cooking, cleaning the house, whatever the tasks are, caregiving for, an elderly parent or something, right? So I think in this kind of situation, very clear communication and setting realistic norms makes a difference, because you don't want to do it all yourself. You don't want your spouse or partner or whomever to do, they can't do it all on their own. And neither one of you are superheroes. You're not going to be able to replace your kid's school, do your best at your job, be there for your own parents while running a marathon on the same day. You know what I mean? And you're not going to be able to do it not because something's wrong with you, but because that wouldn't be like a normal human situation. So I think acknowledging and trying to think, okay, like, let me try to outline what are the crucial steps in each one. What's the minimum I need to do with my kids or my work or whatever, and trying to at least do that if possible. And then if you do anything more, that's like just like a bonus. You know what I mean? Because I think it's a very important time to be realistic and to not overdo it. I was reading this really cool column in the Wall Street Journal. It's like a sports column, and this guy was saying, like, yeah, when the pandemic started, I was gonna train, I was gonna learn a new instrument, I was gonna like start running every day, and now there's been like 2 months. I'm just content if I like wear socks, or something like silly. And I think that really makes sense, because on the one hand, it's like, oh, I have, I don't have to drive to work, so I'm saving a half hour of driving, or whatever. But the reality is, you still have to live life, and it's not an easy situation. We kind of take it day at a time. But I think communicating with your partner, being like upfront about, this is what I really need from you, or this is my situation. I think that's crucial, because if somebody doesn't know your needs or where you are, they can't help you. Being realistic with yourself and the other person, in terms of not expecting too much from them or from yourself, I think is important. And then trying to see what works. Like, if you have that as a starting point, you can kind of adapt along the way and figure out, okay, how can we just kind of get through this week until hopefully the weekend where we can have a little bit of a break time. You know what I mean? Something reasonable.
So we're getting close to the last 10 minutes of this, but I did want to slide in one last question for you because I don't know. I kind of feel like sometimes when we talk about mental health, so much of the focus is on adults, but what about teenagers and children, for those of us, who might have younger siblings?
Yeah.
Help the younger people among us deal with this?
Well, I think kids need a lot of helpful explanations and good role modeling. It's like those billboards where they say kids are watching what you do and listening to, the things you say and learning from you even when it's not a formal teachable moment, they're watching you all the time. So I think being honest with kids and saying, yeah, it's a challenging time. These are the things we need, in sort of appropriate ways. In other words, we're not going to say, well, the coronavirus is a complex molecule that's composed. You know what I mean? We don't have to go into, unless somebody's interested in science, but we don't have to go into like the most difficult details. It's more to say that we need to acknowledge, yeah, this is a challenging situation. This is what we're going to do as a family to stay safe, and we're going to kind of adapt and do our best, and we're all going to support each other. And when we see something needs to be fixed, we're going to fix it. If you notice that I'm doing something, like I have a friend who's or maybe it was my sister. She has two kids, and her daughter, I think, was saying she saw somebody on TV. They were watching a TV show, and the people on the TV show were like next to each other, and she said, "Mom, why are they next to each other? Like, aren't we supposed to be social distancing?" But the TV show was obviously recorded like, months ago, or it might have been like an older show. But, kids their way of processing the world is in some ways different than an adult. And so they need a good amount of kind of patience and explanation of what's going on. And not that any one of us really know exactly how to fix this whole virus situation, right? But something reasonable, like this is a way to stay safe. This is what we're going to do as a family. I think those kind of messages can encourage kids that there's a sense of safety, that you and your spouse, or you and whoever's taking care of the kids, are kind of doing what you need to do, and that's enough. You know what I mean? We don't have to do it perfectly. It's a matter of having some reasonable routines and sticking to them.
Well, I don't know about the rest of you, but I have learned quite a lot. So on behalf of DYP, I want to thank you, Anton, for making time to share your wisdom and brilliance with our members and everyone else who will hopefully watch this after we're done. But before we close, I wanted to give you a couple minutes just to share some final thoughts and perspective.
Yeah, it's a lot of fun. I mean, I actually I often look for ways to try to do some kind of presentation, or like, when you sort of work in a profession for a while, you have sort of like insider information that maybe is hard won, but takes a while to sort of learn. And then I think there's many people want to share, like, hey, what have I learned? Like, I've been a therapist for 15 years now, so I have some knowledge that's like, it's really gratifying to be able to share it with people or to have conversations. And so this is a really great format. I've never done Instagram Live before, but it's a lot of fun, and I think that we have a really nice group. People are, I can tell that we have like an engaged audience. It's really great, and I think I have like a good dialogue. It's like a nice to talk about these topics. So I think this may or may not be related to the COVID situation, but one thing to keep in mind is that there's really two things that therapy is about. One is kind of a supportive space for you to be and kind of take care of yourself. But two, it should ultimately be geared about understanding what your difficulty is. It's sort of sorting through, why am I stressed out? Or what am I stressed out about? Or what can I do about it? You know what I mean? That kind of understanding is very crucial, because you want to walk away from the therapy session knowing yourself better and being more able to handle your life. I don't mean in one day. Obviously, it's not like an overnight success, but over time, you should be learning new things about yourself and how you go about your life and what you could potentially do differently, so that you're kind of more informed and feel more empowered by that knowledge. You know what I mean? Because I've heard a lot of stories of people say, well, I went to therapy and nothing happened, or the person listened to me, but I didn't get anything out of it. And I don't know if that's always accurate, because you don't know what actually kind of transpired. But to me, one of the most important things is self-knowledge, and kind of getting to know more about yourself is a true form of empowerment. It's kind of like being able to say, what can I do in this moment to improve my life? And that therapy is a great venue for that. It's not the only, but it's a great venue for that. And that really should be happening. And if it isn't happening, you want to ask your therapist and say, hey, like, I feel like I'm not really figuring out new things about myself. Why is that? Can we work on that? You know what I mean? I think that should be a real takeaway that we should be getting out of treatment, and can help you inform your life and kind of make you a better decision maker. So it's not only, COVID is kind of like an extra stressful time, but that's just the key point I think about therapy in general that I hope people will remember. And again, like I said before, this is sort of a plug, I guess, but I'm definitely, if you have a question that wasn't answered here, or that people wanted to address, they could definitely call my office. We're happy to talk to people and answer other questions, because one, it's a stressful time, and two, it feels good to be able to help somebody and to be able to contribute in some way. So we're open to that.
Well, please share with us, where do we find you, on Instagram or Facebook? How can people find you?
So the easiest way to find me is to go to my website, which is startmywellness.com. Startmywellness.com is I have an Instagram page, but it's brand new, so I'm just kind of getting I'm a technophobe, I don't know, but I'm just getting kind of in the mix of using Instagram. But really, if you go to the website, all of our information is there. Our phone number, we have 2 offices, so it's easy to find online. But I would love to talk to anybody on this call, or even people who might listen into the recorded conversation, because to me, this is something I'm passionate about, and it's nice to engage with people and answer questions.
Awesome. Well, thank you again for joining us this evening. And be on the lookout, everyone. DYP will be posting hopefully some resources shortly for you guys to take a look at. And thanks again, and have a great night. Bye, everyone.
Thank you. Okay, take care.